This is Sanket, physical therapist at Care Therapy and Wellness, and today we're gonna talk about the KT tape. Okay, so I'm gonna share the information about how to use it, what are the benefits of it, what are the things you have to be careful when you use it. So we'll go over those things. Okay, for sure it is very helpful. I use it in my practice on daily basis. Many patients who comes with the ankle sprain, shoulder instability, plantar fasciitis, tennis elbow, golfer's elbow, those are the very common conditions that we use this at the end of the treatment because it really helps you to stabilize your joint. So another purpose along with the stabilizing the joint is to help you with your circulation and lymphatic drainage. So what it does is that the glue part, when you put it on, it lifts the skin up and helps you with your circulation. Okay, so that's another use for that too. We use many times for the lymphatic drainage. We get a lot of patients with the lots of lymphedema on the leg. We use that in a different ways, that we cut it properly in a fan shape and we anchor it properly towards the lymph node and helps you with your circulation too. So it depends on the use. Most of the time people use to stabilize the joint. Like as I mentioned, some of the conditions are like a shoulder pain, ankle sprain, plantar fasciitis, tennis, golfer's elbow. Those are the very common conditions that we treat them. So what are the types? Like what are the tapes that you get? So you can get the regular tape from the store. Some of the companies, the brand name that is good, that I like it, is mostly Rock tape. This is a good one. The KT tape, which I use it in my practice here, the KT tape. Then there are some other brand as well. But when you buy it, you need to make sure that it's a good quality. It's not like a cheap quality because it can affect the when you put it, of course, it can react to your skin. Okay, so you need to make sure it's branded, it's a good one. You can cut it in a different shape. So this is called eye strip. It's just simple strip. There are some tape that you can get like, pre-cut, which just comes like that and you just tear it. And there are some which comes as a roll and you cut it to your knee. Then there is a Y shape. Okay, so this one is a Y shape. Okay, so we use this as well on some of the joints. And the third one is a fan shape. What we use like for lymphatic drainage on those, we cut it like in very, very small strips and then we use it on the body part. So those are the different types. So let me share some of the very commonly asked questions in my clinic. Like first question that I've been asked many times is that, can I take a shower with it? Most of the tape, if it's a good quality, it is a waterproof. You can take a shower with it. And usually the second question I've been asked is like, how long can I keep it? Normally you can keep it for 2 to 3 days, not a problem. It will stay there. But you need to make sure, if you never used this before, I would advise to use it first time. When you use it, just leave it for 24 hours, take it off, see if you have any reaction to it. If you don't have any reaction to it, you're okay. When I say reaction, what it means is that sometimes you definitely, when you use it, sometimes you get the redness on the skin, which is normal. That redness should go away in 24 hours. If it's lasting more than 24 hours, not good. That means like, you're reacting to the tape. The second common thing is if you leave it too long, and if you're allergic to the glue, or if you're not like, your body is not accepting well, in the worst case scenario, I have seen people get blister. Okay, so that's why I'm saying, like, that first time when you use it, leave it for 24 hours, take it off, and if you're fine, next time you can leave it for 2-3 days, not a problem. Because that different types of tape, different types of glue, different type of quality does affect that. Okay, so that's another question that I've been asked more oftenly. The third question that I would say ask is that, can I use the ice on it? Yes, like most of the time when people come with the ankle sprain, we put this on and then we advise them to put the ice at the home for healing purpose and swelling purpose. So yes, you can put the ice, no problem. The fourth question I've been asked is, can I put the heat? I would not advise to put the heat. The reason is because the glue is activated with the heat. So if you put the heat on it, and then this glue will get more sticky, then it's hard to take it off. Okay, So that's the reason I would not advise to put the heat on it, but you can certainly use the ice. So the fifth question that I've been asked is that, can the tape make my muscle weak? No. The purpose of this is to guide your muscle, to stabilize your joint, to stabilize your muscle. So in that way, usually it helps you. It doesn't weaken your muscles. It actually helps you to normalize the muscle movement. Okay, so that's definitely helps you with the taping. Some of the disadvantage of this, as I said, skin sensitivity is one of them. The wrong technique is another one. If you don't put it right way, it can bother you. It can actually affect your joint function. So you need to make sure you do it right, because I know many times people see the athletic people put it on the shoulder, on the knee, and they think, okay, it's just a tape, different colors tape, and just put it on. No, there is a way, there is a technique that you have to use it to apply properly. Okay, so those are some of the things that you want to be careful with that. And the sixth question is that, how can I take it off? So I suggest that you take it off in the shower, because in the shower you can easily take it off with the water and everything. The another way you can take it off is apply the oil, like a cooking oil or like a baby oil. Apply it and slowly, gently you can take it off. Don't try to rip it off, because that can hurt your skin. Okay. One thing that you cannot apply the tape is if you have any skin conditions like a dermatitis, you cannot apply the tape. If you have any open wound, you cannot apply the tape. So those are the common things that have been asked and I shared with you. If you have any question, you can always call us. Our phone number is 469-212-8888 and our website is surecurewellness.com. Health disclaimer that this all information is for general knowledge. We are not trying to diagnose anything or treat anybody. This one is very general information for knowledge purpose. If you have any specific need, do call us. We offer a free consultation and we can help you with that. Our consultation, you can come to our office. We can also offer online as well. We're based in Texas. So yep, just reach out to us or visit our website. There will be more videos as well. I'm going to share today about how to apply this on the plantar fasciitis and tennis elbow, but you can access more videos for different types of, like, the application of the tape on our website, which is surecurewellness.com. Alright guys, so as we discussed about the use, benefits of the KT tape, some of the disadvantage, now we're gonna see the application of it. So I'm gonna demonstrate today, if someone has the plantar fasciitis, how you can use the tape to the advantage. So as we have another video for plantar fasciitis and what are the symptoms, how you can do some exercise at your home, we have separate video for that. But as we discussed in that video, that plantar fasciitis is basically you experience the pain in your heel, and there is a thick band of fascia, the thick band of plantar fascia, which becomes inflamed and you get the pain right around the heel area. Okay, so it's more in the morning, it's more pain, and pain is around this area. So as you see, this red mark is more like a bend, the thick band, and this is the focus area that we're going to try to address when we apply the KT tape. So I got a 2 eye strip. Okay, so we're going to do this. Now I'm going to show you the position that your ankle has to be before we apply the tape. So your ankle has to be in dorsiflexion, which is kind of like this, and your toe flexion, and you put it like this. So this is the position of the ankle. Okay, ankle dorsiflexion, you're lifting it up and your toes flex. Then I'm going to take one strip, take it from here, tear it from here. Okay, now this portion I'm going to apply on the ball of the toes right here. Okay, so we're going to keep it here like this, take it off. Now what we need is almost 75 to 100% tension like this. Okay, and then you go like this. I'm still keeping the tension, and once I'm coming at the Achilles tendon right here, there is no tension. I just laid. Okay, and then the heat activates the glue. So you have to make sure you rub it like this. So it stays there properly. Alright, and the second tape, the IT, this one, again I'm gonna keep it here. Okay, now this time if you come here, so as we said, like that the second tape, I'm going to start from the inner side. Okay, so right here, your malleoli, right above it, I'm going to put it right like this. Okay, so I put down without any tension. But now once I do that, hold the anchor, and as we mark that blue thing, we're going to come here again, 75 to 80% tension. I'm coming here like this. Okay, stop. Okay, so we came from here, and then we're gonna go here. I'm still keeping the tension, and here no tension. Okay, again activate the glue, and there you have it. That's exactly how you do it for the plantar fasciitis. Okay, so one from top to down, one from in, and go all the way like this. Okay, all right, so that's the plantar fasciitis. All right guys, so now I'm going to show you how to tape for the tennis elbow. It's very common problem for not only people who play tennis, but also in a routine where you use your hands. Some repeated movement of this, like in the rotation, cause the problem. So here I have marked here right on this red mark around here. So this one is a lateral epicondyle. Also the tennis elbow, also called like lateral epicondylitis. Okay, so what happened, this is a common extensor group of tendon here which originate, and it goes like this and goes in the hand. So what we need to do is that we have to take one tape and make a cut, like a kite shaped cut in here. Okay, and then the positioning is pronation. Okay, the wrist little bit flexion. Okay, like this. Then you're gonna take this off. This will be a little bit tricky because you have to put this in between the index finger and the middle finger. So you're gonna put it right here in between the fingers. You go in, okay, you tap it in the down, then you take it off. Now it's about 80% tension. Okay, keep it this way, and you're going over, and then like this. Okay, rub it to activate the glue. Okay, and then we need the second one, Y shape. Okay, so then you're taking it off from here, and this, gonna put it right around here where the origin of the pain. Take one strip, okay, about 50% tension, and go. Okay, you can turn like this and take the second one, 50% tension, and go across like this. Okay, and activate the glue. All right, so just to recap, pronation for the first strip. Okay, your wrist a little bit down. Okay, and see this middle finger, usually there is a one common tendon, extensor carpi radialis brevis, which comes all the way here. And many times the quick test you want to check is if you ask the patient to just lift the finger up. Okay, lift it up, Okay, so when she's going up against the resistance, usually the pain is here. So if that happened, that is for sure that tendon is affected. So when we do this one supported, okay, and then all the way up here, so that helps you to stabilize this area. And then we're anchoring with the Y strip base here. One goes across on the flexor group and like this. Okay, so that's how you do it for the tennis elbow. Okay,